Hello, welcome to New Life. I am Dr. Alice Benton, one of the co-hosts here on New Life Live. I'm going to talk with you today about depression and community. First, we're going to look at the symptoms of depression so that you can evaluate for yourself or for your loved ones if you're seeing or experiencing some of these signs. And then we're going to talk about the importance of community and how community can break through depression. It's like light breaking into the darkness. So first of all, symptoms of depression. It's usually multiple symptoms taking place more days than not over a 2-week period, including a low mood, a depressed mood, sadness, usually tearfulness. Sometimes the tearfulness feels inexplicable, doesn't seem to make sense at the time and in the circumstance. Feeling like a failure, feeling like a disappointment to the important people in your life. Disturbed appetite. It can be an increase in appetite, loss of appetite. Disturbed sleep, and this can also go to either extreme, whether it's excessive sleep and usually waking up and not feeling refreshed, or struggling to get to sleep, struggling to stay asleep. Thoughts of worthlessness, hopelessness about the future, an inability to see a light at the end of the tunnel. Loss of energy, low energy, lack of motivation. Usually there's an agitation and an irritability, a touchiness. Thoughts of death are altogether too common, and this can be a scary topic to touch on, but I'm going to go into a little bit more detail and differentiate some of the different kinds of thoughts of death that people have. There can also be fantasies about running, just getting away from this life, this version of this life, and starting over somewhere else. And again, for a full clinical depression, the majority of these symptoms have to continue to take place more days than not over about a 2-week span of time. And it's common to have episodes of depression where you might have 2 weeks of this, you feel a little bit better, and then it comes around again. So I'm going to differentiate between morbid thoughts and suicidal thoughts. Morbid thoughts are more common, and they're associated with a lower risk level. Morbid thoughts tend to be, I don't want to wake up anymore, wish I could fall asleep and just wouldn't wake up the next morning, or I wish God would take me now. I pray that God would just take me and end my life. But it does not include active thoughts of taking one's life. It's wishing your life would end. And then there are suicidal thoughts, passive suicidal thoughts, and active suicidal thoughts. The passive category is a wish that something would happen to you to take your life. So I visualize getting hit by a car. I wish I would get into a car accident, but I'm not going to take action to initiate the accident. An active suicidal thought is the most dangerous category, and it shows a much higher risk level, which is the thoughts and the fantasies of what you could do to take your own life and thinking out different scenarios of how you would go about doing that. The difficulty in this, one of many, is that it can be so embarrassing and shameful even to admit to oneself of having the suicidal thoughts, let alone bringing that into relationship. But we're going to see how it is key to bring it into relationship. Now, a couple of things that really exacerbate these symptoms that we've been talking about is ongoing sleep deprivation, which can actually lead to psychosis if it happens long enough, and it doesn't take very long. Even just a couple of weeks of extreme sleep deprivation can lead to psychosis. Substance use certainly exacerbates the depressed mood, but also can make a person more vulnerable to following through on the thoughts of suicide. And the one I really want to lean into is isolation, because again, the shame and the embarrassment and the belief of I'm probably the only one feeling this way and feeling this bad, and nobody cares, and nobody wants to hear my sob story, and I don't want to be a burden to anybody else around me. All these thoughts and this shame can keep a person quiet in their depression. And it's just natural when you're feeling this low to back away from people rather than coming toward people. But both the mental health recipe and God's recipe for depression are bringing it into the comfort of safe relationship. And it has to be safe relationship, not just any relationship will do. Because some of the things that we do incorrectly in a good intent, a good motivation to try to help, is trying to fix it too quickly, giving unsolicited advice, trying to convince a person out of their depression. You're fine, you're not that bad, it's going to be better, look on the bright side. That doesn't tend to be helpful in the midst of a depression. Rather, it's like a person who's depressed is in a dark room. And if we bust into the dark room and flip on all the lights to show them that it's better than they really think that it is, the light will blind them and they'll be in pain and discomfort and they'll back away from us even further. So the tack that we should take is actually going into the dark room with them, sitting down with them in their corner and finding out just how very dark it is, just how very heavy their burden is. And by sitting there with them in the darkness, validating and empathizing, we can then slowly turn the lights on, slowly bring them out to the doorway to help them see that things are better. But they need the comfort and they need the companionship usually first if they'll allow it. But there is such a risk in asking for help because you might feel like a burden. But in God's design, He asks us and He built us to do better when we carry each other's burdens. This comes from Galatians 6:2. We're supposed to help one another when those burdens are too heavy for one person to bear alone. It's good for us to ask for the help. It's good for us to accept the help. Once you break out of the silence and the isolation, you find out something essential, that you're not alone, that a lot of people around you are actually experiencing depression too. The morbid thoughts and the suicidal thoughts are not uncommon, and they've really increased in this past year as well. You're not alone. And when you start to hear from other people, I know what you mean. Me too. It is a bolster, it's a comfort, and it strengthens you. God also gives us a couple of spiritual practices that even whether or not you're a believer, these are put into practice as well, just in the secular mental health world, because they work. Depression can be rooted in the guilt that you feel for things you have truly done wrong. And so confessing that to other safe people is a step out of the darkness. You are probably burdened with justified resentment, and being able to talk through the pain that others have caused you, to confess that you have anger, to confess that you don't want to forgive, opens that door, brings a little bit more light in, allowing God to move you towards forgiveness of the people that have done the unforgivable towards you. If you'll ask for His help, He will give it to you. And then accepting forgiveness for your own sins. And we really need to accept it both from God, but from other human beings, because it makes it more real. When we apply God's design, when we take the risk of breaking out of isolation, and when we lean into relationship with both God and other people, the light does break through the darkness. Please call us here at 1-800-NEW-LIFE. We want to be part of that light.